Moving on from the lower limb to the upper limb. And here we're also going to the territory of orthopedic surgery, as this is the first station with fixation devices. Notwithstanding that, this first piece is just a healthy arm where I can see many of the structures. Not so different from my own arm I've spent so much time drawing upon. So you can see some forearm flexors here, responsible for making these sorts of movements. You can see all the muscles of the hand. For example, if you're going to pull something outwards, you're going to abduct it. So muscles on the outside that pull apart will be abductors. Now, if we're bringing them inwards together, we will have adductors. You could also have flexors, which flex things, or an opponens, which opposes fingers. We also have lumbricals and interossei, of course, but it's hard enough already to see things at this distance behind the glass, so perhaps at some other occasion with some magnification. Here we see the elbow, and we can clearly see the biceps, and what we were talking about in the neuroanatomy section, the brachial plexus. So you can see it coming here, and all the different nerves emerging as roots become trunks, divisions, and cords. But here we're already seeing the cords, right as they go above, anterior to the subscapularis muscle, which is still covering the scapula. And we can also see the clavicle coming towards the camera, and also a piece of the humerus back there, below the deltoid muscle. So if you want to have a reference for a comparison, this is what you are seeing. And thus we get to the part about fixing broken bones. Here we have a plate and screws, an internal fixation device for ensuring the bones consolidate in the right position. So essentially, during surgery, place the bones back in their correct place, and then you screw them down to make sure they